Welcome to my PEP lecture. So dear students, in this lecture I will discuss about the endogenous substances. So the first endogenous substance, that is enkephalins. So enkephalin, the first real breakthrough, came from the discovery by neuroscientists John W. Hodges and Hans W. Kosterletz at the University of Aberdeen in Scotland of the two potent naturally occurring analgesic pentapeptides. Pentapeptides mean peptides containing 5 linked amino acids and extracts of pig brains, and they call these compounds enkephalins, and since then at least 6 more have been found. Endorphins, these are larger peptides which are called endorphins. It also comes under the category of endogenous substances, endorphins. So these are larger peptides called endorphin, have been there for the first time isolated, and these contains a sequence of amino acid that can be split up as enkephalins. Now the types of receptors, as we have already discussed, and opioid analgesics. So there are at least 3 types of receptor on the brain neurons that are activated by the enkephalins. Morphine and its congeners are thought to exert their effect by activating one or more of these receptors. Now, what are the clinical uses of opioid drugs? The clinical uses of opioid drugs, they are used as a pain relievers. Opioid drugs are useful in the treatment of general post-operative pain, severe pain, and other specific conditions. The use of opioid to relieve the pain is associated with the kidney stones or gallstones, presumably depends on their ability to affect opioid receptor and other tissue and inhibit the contractility. Opioid drugs, they are also used for the relief of respiratory distress. This is the second clinical use of the opioid receptors. So it is used for the relief of respiratory distress. Low dose of opioids, they are also used for the relief of respiratory distress that accompanies acute cardiac insufficiency complicated by the buildup of fluid in the lungs. This is the second clinical indications. They are also used in the treatment to relieve the abdominal distress. Opioids, they are also able to relieve the abdominal distress and fluid loss of diarrhea. The fourth clinical use of opioid analgesics, so these are used in drug therapeutics. Several commonly used natural synthetic derivatives of morphine are used in drug therapeutics. While the sixth one is codeine. So codeine is also a naturally occurring opium alkaloids. It can be extracted from the papaver somniferum. That can be made synthetically as useful oral analgesic, especially when used in a combination with aspirin. Moreover, the other opioid analgesic is mepridine. So mepridine was an early synthetic analog of morphine marketed under the trade name Demerols, that was originally thought to be able to provide significant short-lasting analgesia. One is analgesia and the second one is algesia. So analgesia means to relieve the pain sensation. When the pain sensation become relieved, that condition is called analgesia. Algesia means when there is pain sensations. So actually it is a Greek word. So when there is no sensations, as we are using different type of local anesthetic and general anesthetic agent, inshallah in my coming lectures I will discuss each and everything in details. And later, so that was originally thought to be able to provide significant short-lasting analgesia and little or no addiction because of its short in duration of actions. However, this belief proved false. Methadone, this is another agent. Now, what is methadone? So methadone is actually pharmacologically, it is a synthetic opioid analgesic. So methadone is a drug which is used to relieve the pain sensation as well as to induce sleep. So it has long-lasting analgesic effects 6 to 8 hours when taken orally, and it is used to moderate the effect of withdrawal from heroin addictions. Now come to our opioid antagonists. Opioid antagonists, this is another one is opioids agonists, and these are opioid antagonists. So opioid antagonist drugs, these are among the opioid antagonist drugs like naloxone, naltrexone. So it's longer lasting orally active version as naltrexones, which are used primarily to reverse the morphine overdosing. Let's suppose if morphine overdosing occurs, so in order to overcome that condition, naltrexone is used, which is used as a opioid antagonist. And whenever there is toxicity or overdosing of morphine occurs, so naltrexone is used as an antidote and to reverse the chemical stupor of the wider variety of the cause, including alcohol intoxication and anesthesia. An opioid overdose, these drugs provide recovery within minutes of injection. They can, however, also precipitate severe withdrawal reaction in a person addicted to opiates. Now, these are the side effects of the narcotic analgesics, which is reported by the different literature survey. And these are the literature report the side effects of narcotic analgesics. It may be in the form of chest pains, trouble in breathing, respiratory depressions. Initially, morphine was used as a general anesthetic agent, but the problem was that due to use of morphine, respiratory depression was occurred in many of the people, so they were died. So due to that reason, the morphine become banned, because morphine caused respiratory depression as well as it caused bradycardia. So these are the side effects which is reported after using narcotic analgesics. So it may be in the form of trouble breathing, abnormal heartbeats, cardiac arrest, and death, and severe cases. Narcotics applications and dentistry. Narcotics analgesics are extremely effective in reducing acute dental and post-operative pain. The narcotics analgesics have been established in a niche for the treatment of the pain in those situations where the NSAIDs they are less effective. Hydrocodones, oxycodone, codeine, and occasionally mepridines, these are the narcotics used to treat dental pains. Now come toward the side effects which are reported after the administration of morphine. Morphine causes vomitings. So you have also remembered the lectures which I have delivered about the side effect and adverse effect, that how side effects can occur and how we can differentiate between side effects and adverse effects. So these are the side effects which are reported and the literatures where and these are the side effects of morphines if morphine is used. So these are the main side effects. There may be chances of vomiting, so it causes respiratory depressions. Morphine also causes decreasing of blood pressure, low blood pressure. Side effects of opioid analgesics: respiratory depression may occur, and euphoria may be occur. Euphoria mean when you are in this state of pleasures. Relaxation and sleep, tranquilizations, decreased blood pressure, constipation. This is also the major side effect which is reported after the administration of morphine, and hypothermia may be occurred, low temperature, flushed and warm skin. These are the side effects of the morphines. Side effects of analgesics are, it may be in the form of constipations, so drowsiness, dizziness, stomach upsets, ringing in your ear, skin itching or rash, dry mouth, aggravation of asthma, and heartburns. Thank you so much. So these all were the terms which are related to the opioid analgesic. Inshallah, my next lecture will be, inshallah, I will present my new lectures and other non-steroidal anti-inflammatory drugs. So thank you so much for watching my presentation.